Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them faster than your body burns carbs. This video deconstructs the poliovirus, a virus that attacks motor nerves. Take a crack at these questions before we start. Can poliovirus survive in the stomach? How does polio spread from person to person? Which antiviral is recommended for polio treatment? Let's do this. Before vaccines, polio paralyzed tens of thousands of children during major outbreaks like 1916 and 1952, leaving many unable to walk or breathe on their own. Summers brought fear, until vaccination campaigns made one of the world's most dreaded diseases nearly eradicated. Poliovirus is a member of the Picornaviridae family. It's a positive-sense single-stranded RNA virus. That means once inside a cell, its RNA may be used to start making viral proteins without extra processing, unlike negative-sense RNA. Polio's icosahedral capsid shields its RNA genome. Without a fragile lipid envelope, polio can survive stomach acid when ingested, as well as tough conditions when free outside the body. There are 3 serotypes, 1, 2, and 3, based on capsid protein differences. Vaccines must cover all of them to give full protection. Polio's virulence involves its capsid proteins, VP1 to VP4, attachment to the CD155 receptor, and a preference for infecting anterior horn motor neurons. The capsid proteins protect polio's RNA and help it attach to cells. CD155 is the receptor that the virus binds to enter host cells. Tropism for anterior horn motor neurons causes the characteristic flaccid paralysis. Polio spreads mainly through fecal-oral transmission. People ingest viral particles from contaminated food, water, or hands. Oral-to-oral spread can occur early in infection, particularly via saliva, helping the virus reach new hosts before symptoms appear. Polio mainly affects unvaccinated children, travelers to regions where the virus still exists, and people with poor immunity, who are more likely to develop severe or paralytic disease. Polio has an incubation period of 7 to 14 days, during which it replicates in the oropharynx and intestines. Most infections are asymptomatic. When symptoms occur, minor fever and malaise appear shortly after incubation, sometimes progressing within a few days to aseptic meningitis. In less than 1% of cases, loss of motor function occurs without sensory changes. That's because polio primarily targets anterior horn motor neurons within the spinal cord, which control voluntary muscle movement. Asymmetric flaccid paralysis typically appears 1 to 10 days after early symptoms. In severe cases, polio can weaken brainstem neurons, affecting swallowing, speech, or breathing. Post-polio syndrome may develop years later with gradual muscle weakness and fatigue. The virus has no link to cancer. Polio is usually diagnosed based on the presence of asymmetric flaccid paralysis, fever, and exposure history. Reverse transcription polymerase chain reaction of the patient's stool or throat swabs, as well as cerebrospinal fluid analysis showing increased lymphocytes during the meningitic phase, may be used to confirm polio in evasive cases or to monitor outbreaks. Treatment is supportive, since there's no specific antiviral for polio. Care focuses on relieving pain or fever, maintaining hydration, supporting breathing if needed, and helping patients move or walk with physical therapy or braces. Prevention relies on vaccination. IPV is a killed, injectable shot that's very safe. OPV is a live, oral vaccine that's easy to give to children who are at greatest risk of serious illness. Good sanitation and hygiene also reduce fecal-oral transmission. Let's go back to these questions. Can poliovirus survive in the stomach? Answer: yes. Polio is acid stable. How does polio spread from person to person? Answer: mainly by the fecal-oral route, sometimes by the oral route in the first few days. Which antiviral is recommended for polio treatment? None. 0 errors. Conqueror. If you learned something from this vid, help us grow by tapping like, share, and subscribe. Scan the summary table in the description. Thanks for watching. Keep vibing with Medin 5 for more 5-minute med hacks.